Hi, my name is Justin Nutt. I am the Deputy Executive Director of Mental Health Resources in Eastern New Mexico. I'm also a clinical social worker, and this is a presentation and CEU approved by the state of New Mexico on the psychology of the COVID-19 pandemic as it relates to mental health and response during the pandemic and after. As Deputy Executive Director with Mental Health Resources, I have clinical oversight of our programs, ranging from outpatient to multisystemic therapy, intensive outpatient program for addiction, mental health, and all of our other clinical programs. I also provide oversight for our psychiatric prescribers and medical staff, as well as our nursing staff. I'm also the owner of Nurse-Led Consulting Services. We do consulting for leadership, employee engagement, business culture, business psychology, downsizing consulting. On the business side, from a clinical perspective, we provide program development and design, psychological jury consulting, critical incident debriefing and crisis response, both planning and active services. And as with this, we do multiple trainings as well as public speaking engagements. The new normal is a really catchy new phrase that everybody's been using to describe what we're going through. Honestly, even I've used it in presentations, but the reality is it's a inaccurate term. The new normal, normal would be a status quo, how things will be, kind of a flat line where we exist. The reality is right now, we're not looking at a new normal. We're looking at the current normal as it relates to the ever-changing restrictions, our concerns related to infection and infection control, and a myriad of other things such as how it's impacting employment and business and society and the economy. So really, we're in a current normal, and our current normal even is changing on a regular basis. Every day, there's new restrictions or lifted restrictions, changes in what we know as far as knowledge. The really current normal is a better term than new normal, because new normal would denote that there is some lasting, this is what we will know. It really hasn't been established yet because we don't know what the long term will be. Normal is the acceptance of equilibrium, and as I said, that's not where we are currently. A true new normal can't be established until we're out of this crisis. When I say that, I do not necessarily mean until we get a vaccine. I mean, until the restrictions are lifted to the point where they will stay, until preventative and precautionary factors have played out. To give a good example, the new normal for terrorism wasn't established when 9/11 happened. It wasn't established on September 11th or even September 12th. 9/11, it grounded planes. 9/12, it was agreed short term what the restrictions would look like. But long term, TSA has become the new normal. When we fly before 9/11, we got there, we showed them our ticket, we got on a plane. Now we go through body scans, metal detectors. TSA is there, and we're worrying, is a bottle over 3 ounces, and that's just normal for us. I literally don't even think about the idea of carrying certain items on at this point, simply because that is what normal is. That is the equilibrium that we settled on. And when it comes to the new normal for the coronavirus and COVID-19, we're not there yet. The new normal post-COVID, psychologically speaking, the new normal requires we consider the impact of the current crisis. This is a unique situation as far as this pandemic. And we have to look at the clinical pieces generally attributed to more commonly experienced events than a pandemic to really understand what we're experiencing now and what we will continue to experience in the short term as well as in the long term. Things like stress, fear, trauma, grief, anxiety, depression, and then eventually recovery. Just as we look at things like a loss of job, that is not our new normal. Our new normal is, what does it look like after that initial period where someone might be on unemployment or searching for a new job? And the first item, obviously, is stress and fear. That was the first response that many, if not most, of us had. Stress is a psychological response. It's created by the emotional reaction to an event. Currently, the stress is a response mostly to fear, mostly to restrictions. But really, to understand what it is that we're afraid of, we have to understand really what fear is. I have a very deep-seated personal and clinical belief. Really, the only fear that exists is a fear of the unknown. Every other fear is just a product of that fear of unknowingness. When you look at a fear of snakes, are you truly afraid of snakes, or are you afraid you might get bit? If you knew a snake wouldn't bite you, would you be scared? A fear of heights. Are you really afraid of being that high, or are you afraid as a result of the fact that you might fall, you might slip? That feeling that if you do fall, that it will be a painful outcome as a result. There's a line in a poem, and I don't remember who the author is, unfortunately, but it says that a bird's never afraid of falling. It will sit on a limb, not knowing if it will hold its weight, but it doesn't fear that it'll fall because it knows it can fly. The same is true when it comes to fears of the unknown. It's not the actual thing that we're experiencing. It's not heights, it's not snakes, it's the fact that we don't know what the outcome will be. Like I said, a bird knows that if he sits on a limb and it won't support his weight and it breaks, all he needs to do is flap his wings and move on to the next branch. Currently right now, even as we progress through new restrictions or lightening of restrictions, everything's unknown. What we were free to do yesterday, today we're not free to do in some cases. Things that we had set in stone as far as limitations of gatherings. As we progress back out of the restrictions, today we may say you can't have more than 5 people, you can't have more than 10 people, you can't have more than 25%. Tomorrow, we don't know what that'll look like. The governor may come on, the president may come on, whoever your authority is, and say, today we're at 50%. Or he may say, we had an outbreak, boom, we're going to go back to essentially a lockdown, which we were in a lot of cases here in New Mexico, especially as it relates to retail and non-essential businesses. The other fear that many people have had throughout this pandemic is we don't know who's positive. Some people walk through their entire day wearing a mask, not wanting to touch things because they don't know who's positive. They don't know if somebody's asymptomatic. They don't know if somebody will become symptomatic and is positive and could transmit that to them. We don't know where the virus came from. There's a lot of theories. There's a lot of speculation, but I don't know necessarily that we'll ever know beyond it was transferred across the species line as a novel virus from bats that are from a specific area in Asia. But that fear and stress of the unknown itself, it's the unknown aspect that we address. We also don't know when can we return to work, school, church. When can I go to my own favorite restaurant? When can I go and hang out with my friends? We don't know what that's going to look like at this point, and we don't know what it's going to look like next week or next month. It could be better, it could be worse. And then there's also the fear just the everyday overall unknowing of what life itself will bring as an outcome of that. You know, it isn't a fear of any of these things, though. It's a fear of not knowing when these things will change, when these things will end. It's a fear of the unknown. And that is really, I think, one of the key aspects of this is it usually is something that we can look at and say, I fear this. Whereas with this, it is truly the unknown that we're afraid of. You know, then when you look at stress, normal stress reactions are to be expected in the current situation. And it's important to know that some of the common stress reactions we're all going to experience, or in some combination of them. You know, there's very normal stress reactions. Some of those being, a change in activity levels, difficulty communicating with others, irritability, anger outbursts, frequent arguments, inability to rest, relax, let down. Or the flip of that, which is, a change in sleeping habits. Some people will sleep less. They'll be hypervigilant. Some people will sleep more as a result of this. And then also a change in eating habits, which again could mean people are eating more. I believe there's going to be, the COVID-19, kind of like the freshman 15. And for a lot of people, there's going to be that weight gain because you're at home and you're eating more. Other people, due to fear, anxiety, and stress, they're going to eat less. The stress we are experiencing in the present, that's normal. Simply because we are in a stressful event. Those reactions are normal. It's going to be the reaction to any situation of unknowing and a lack of what's viewed as normal, because as we said, this isn't normal. This isn't something any of us has experienced before in our lifetimes, with the exception of a few people, that are still surviving that were alive in 1918. This is something that of this magnitude we have not experienced in recent times. After we look at fear and stress, really we need to look at what's going on. Why is this having the impact it is? And directly related with that fear and stress, this is a trauma event. Trauma is defined as a deeply distressing and disturbing event. We tend to attribute trauma to something far more severe, far more single event related, whether that's war, divorce, child abuse, death even of a loved one, loss of a job, that type of thing. But we also have to understand that events like the COVID-19 pandemic and things like the Great Depression, which lasted for an exceedingly long time, longer than this pandemic will. Those are also traumas. Those are also traumatic things. And no matter what the cause is, if our reaction and the trauma itself is not identified and it's not addressed, there is a likelihood of long-term adverse outcomes. With trauma and COVID-19, it's not a single event. It's not, I've worked with individuals that were in Iraq and they watched an IED explode and kill people in their unit. That's a single event. It's a very pinpoint moment in time that we can pinpoint and say that this is the difficult trauma. With COVID-19, really we're creating complex trauma. There's the virus itself came out. We worried as we watched it in China. We worried as the first cases came to America. There's more trauma as there were restrictions. There were shutdowns. As a result of those shutdowns, we had loss of job, loss of school, loss of freedom, and all of these things build on each other. That's not to say that a single pinpoint trauma isn't severe. It doesn't have the possibility of having severe outcomes, so much as to say, once that event is addressed, we tend to be able to progress a little easier, whereas in the current time, much like with the Great Depression, we have a series of events that compound the previous events. as the restrictions were put in place and restaurants were closed, we had to worry about access to food. We had to worry about access to supplies at the grocery store. When the restaurants were shut down, some people were laid off as a result of that. And unemployment soared. We also have to look at the loss of business. And as we look at these, each one builds on the other, re-traumatizing us and traumatizing to us to a greater degree because it's building on that previous trauma. And deeply intertwined with trauma is that fear and stress, that fear of the unknown. What's the next time that it's going to come out? You could liken it to child abuse or domestic violence, having done a fair amount of work in that. And the thing that is often said by survivors of domestic violence is they never knew when that other shoe was going to drop. They never knew when that abuse was going to happen. And as a result of that, they lived in fear of that unknown. And most trauma is a very personal event. It might be shared by a small group, such as the event I was talking about with the soldier in Iraq. It may be shared by siblings. If it's an abuse situation, it may be shared by a family if it's a death or a loss of a job. But most trauma is a very small segment, either individual or small group experience. The pandemic and all that surrounds it is a shared trauma, honestly, on a level that, again, none of us have experienced before. It's an event that is being experienced not just locally, not just in your family, not just at the state level, not just in our country, but across the world. And clinically, we normally would view shared trauma as an event we experience with a patient that we're working with. Someone who lives in New York, 9/11 happened. They experienced that on a personal level. And then they worked with patients after that were victims of it as well, that lived there, experienced that, or at the airport, whatever it may be. But in this case, everyone we encounter, rather, I apologize, has experienced this to some degree. And not only is experiencing it, or has experienced it, but is experiencing it, repeatedly on a day-to-day basis. Things change. So for all of us that share trauma, that complex trauma is a difficulty that we need to consider, not only for those people that we're working with, not only for the general public, but for ourselves as professionals, to be aware of how the events that other people have experienced and are sharing with us is going to impact our own lives. So I can say, there are negatives and positives of shared traumatic events. When we look at shared traumatic events, the negatives are obvious, honestly. The negatives are that we're exposed to those events, and the events impact on others, and it can serve to re-traumatize us, and a level of vicarious traumatization. The positive is all of us understand what each other's going through to some extent. Much like someone might say at an AA meeting about being an alcoholic, I haven't done the things you've done, I haven't said the things you said, but I felt the things you feel. And I think that that's very apt here for the simple fact that we're all experiencing this trauma and the pandemic in some way, shape, or form. And those emotions that we're experiencing are very similar to the emotions that most everyone that we'll encounter as far as the patient or client, family member, friend, or someone just in the general public who also have experienced. And this can be a very positive thing. It can be a very negative thing. To give you an example from my own life, before I moved to Clovis, New Mexico, last August, I actually lived in El Paso. And I actually moved a week after the El Paso shooting. So when the El Paso shooting happened, before it, El Paso was an extremely safe community. It was truly safer than probably pretty much anywhere I've lived per capita. I was driving actually to a friend's going away party when the shooting happened, and we found out little bits and details from law enforcement friends, and we knew what was going on to some extent. As the day progressed and the events of the shooting and the news coverage carried on, we sat there and we spent time with each other, and we drew close in that moment, just like most of us did during 9/11. For me personally, it was a difficult time, but those people around us, or around myself, I should say, we were able to draw together, even as we watched friends of ours respond to the shooting and not knowing what's going on with them. So after that, I actually did crisis response with the El Paso Sheriff's Department, multiple Fortune 50 companies that are located in El Paso, including Walmart. And as doing that, I experienced what they experienced to even a greater extent. And some of that did have an impact on me. But there was a difference compared to where we're at now, which is on that day, whether it was 9/11, the El Paso shooting, the Las Vegas shooting, once the planes hit, once the buildings fell and the planes were grounded and we knew the attack was over, we were able to say, this is the point where it stopped. Right now, as I said, this is something that's carrying on. This is also something that will have a long-term outcome for some people. So that is something that is very important to think about as well when we talk about how we work with someone who is experiencing all these things and how we make sure to do our own self-care. The next item I think is important to discuss, it relates directly to the trauma as well, is that funny little feeling most of us have felt. By the time you watch this, multiple other authorities have probably already told you that funny little feeling that most of us couldn't put a pinpoint on. Why are we feeling this way? I don't know. It's just this little uneasy feeling in the pit of my stomach. That feeling is grief. And grief is one of the most common reactions to trauma. That odd little feeling, that grief that we're feeling, is the same as in any other situation. It's just, as I said in the beginning, we have to, in a situation like this, look at events and outcomes that we usually prescribe to more commonly understood events. Grief we tend to look at as divorce, loss of job, death of somebody we care about. This is the same, however, it's that same loss that we're experiencing. We're currently have lost what it was to be an American. We've currently lost what it's been, what it is to honestly be a human being through the loss of socialization. Normal life went from work for adults, school for kids, church on the weekends, if that's something that you attended, and socialization with other friends. Eating out, all of those things were lost, and they were lost in rapid progression, completely out of our control. Just as a death, for example, would be something we would grieve over. This too is something that, as a population, as individuals, we are grieving over. And so again, that's another item that, as a professional, we need to be aware of within ourselves to make sure that we can refill our pitcher, so to speak, when we're providing care to others, and not letting their grief overwhelm our grief and compound that problem for us. Another feeling that we're having for a lot of people is that anxiety and depression, and it's directly connected with that stress and that trauma and that grief. And for most, this anxiety will slowly subside once restrictions are lifted or eased. As we move through those stages, the anxiety is reduced. We're allowed to socialize more. We're allowed to go out to eat. We don't have to worry about it if we're going to be able to get chicken or beef or toilet paper even when we go to the store, and that ties directly to that fear piece of that unknown, creating that anxiety. Once they're lifted or eased, most people will not have a difficult time transitioning out of that anxiety. Natural levels of anxiety will remain short term as they're lifted because we're not really sure are they going to stay lifted. As they're eased up and we're allowed to go back out to eat, are we going to be able to go back out to eat next week? Or is that something that we're going to have to, again, worry about a shortage of toilet paper? It's an anxiety feeling because of the fact that, one day we're told it's dangerous to eat out. The next day, at some point, we will be told, feel free to go eat a meal at your favorite restaurant, and not even just told that to feel free, but encouraged because it is needed to revitalize the economy. It's needed to help small businesses recover. But the farther we get from the restrictions, the farther we get from the active pandemic, the less that anxiety will be for most. For some, the anxiety, though, is obviously going to persist. But it's directly related back to the trauma and how it was or wasn't addressed. I think the more that we address the trauma, the grief, and the anxiety in the present, the easier it will be for those individuals to reduce that anxiety related to eating out. The anxiety that just is persistent with them related to a fear of what if this happens again. As professionals, what we really need to focus on is the idea that once we recover from this and we show that we can recover from this, we can use that to help a person who may be feeling anxious in the longer term to understand, just as we recovered from this, even if there was to be another pandemic, even if there was to be another terrorist attack, whatever it may be, we have those skill set that has helped us work through it once. We recovered from it once. We will have the ability to recover again if it happens. Again, that knowingness is going to help with that reduction of long-term, long-lasting anxiety. Rarely do we think about anxiety as professionals without also considering depression. The two, I like to look at them kind of like unhealthy friends. They hang out a lot, but don't bring out the best in each other. Right now, depression is the biggest concern for mental health professionals. We have seen in many areas a skyrocket in assessments at hospitals related to suicidal ideations. We've seen a massive increase in the number of suicides that are occurring directly related to that restrictions and the pandemic and that lack of socialization and what we considered pre-COVID to be our quote unquote normal. Depression is the biggest concern, not just as it connects to anxiety though about the virus, but also those restrictions. So it's important to remember that while some people, their depression and anxiety is connected to the virus, the restrictions are really the piece, I think, from a personal clinical opinion, the restrictions themselves are the piece driving the largest amount of that depression. Social distancing, is designed, it was implemented to help curb and flatten the curve and the spread of COVID-19. It was not designed to destroy social interactions for social interaction's sake and distance us as a mental health or a psychological piece of what social interactions look like. Really, that social distancing, as we all know, was a medical scientific approach to reduce the contact and interaction that would spread the virus through those social interactions of being gathered with a large number of people in close proximity or for a long period of time. Medically, I would say that in some ways those restrictions have been very helpful. We could have seen a much larger spread if we were constantly in full office buildings, If you think of a call center, you have a huge open room with cubicle walls that are about this tall and hundreds of people in there. If we were to say that's totally acceptable, keep doing that, I think we would have seen a larger number of positive cases come out of that, and due to a larger number of exposed, larger number of positive cases, we would have had a larger number of deaths, hospitalizations, and adverse outcomes related to it. But the thing to consider from our perspective as mental health professionals, psychologically speaking, the restrictions have taken away a key piece of really what it is to be human. As humans, we are social beings. We may not constantly want to be around people. We may be introverts. Even introverts have those people they enjoy being around. I think about what we've lost as far as events. School ended. I know people that have not been able to get married or did Zoom weddings. Recently, a lot of the schools decided or have already done graduation in a way that was completely different than any of us would ever think, unless it's distance learning and they mail you your diploma, that you expect those big events to be surrounded by friends, to be a celebration, and we've really taken that away. We've created isolation from others. We haven't seen family members, whether it's our parents or grandkids. We haven't seen friends. And so for species, it's a very social species. That's going to be difficult for us. Isolation is one of the biggest causal factors of depression in a pandemic setting, and it can be compounded by the fact that when you're depressed, sometimes you wish to isolate. Adults are able to understand this. Even high school students, as difficult as it may be for them to understand that they're a senior and they don't get to graduate the way that they thought. They don't get to have that goodbye with that teacher that they truly loved or that was a mentor to them. They can understand it. Little kids, they really don't. And so we have to think about how do we address that with our child. I have a 4-year-old. I've, through the whole course of this, just said we can't do certain things because people are sick, because people are hurting. And for her, she understands that. She doesn't understand why it's not similar. In some cases, she doesn't understand, why can't we go to church? If I was sick, I wouldn't go to church, but church would still happen. So why, since I'm not sick? And so it's been difficult to understand that. And for her, it's been very hard. I would say she's been more anxious. She's been depressed, even at 4. She's depressed of not seeing her friends at church and school. And to go back to that piece of shared trauma, this isolation that we're experiencing, it takes away in many, many facets the benefits that exist as a result of shared trauma. When I went through 9/11, when you went through 9/11, when anybody went through 9/11, what happened? We reached out to those we loved. We shared that with them. We talked about it. We hugged. We loved a little deeper for them, especially right then in the aftermath. We drew together. We hung out together to make sure that we had those people close to us. Right now, we don't have that. We don't have the ability to spend time with the group that we choose outside of our own biological family or marriage, whatever it may be, the people in our own household. For the most part, we don't have that ability to socialize. And so the restrictions have created that other piece that make that difficult. And the other piece that I would bring up with respect to that is consideration about suicide. And I'll talk about some of the outcomes, which are more the psychological foundation, but I think it's important to address this now as well. One of the biggest concerns that I've seen in my work, at least, is that because we're social distancing, it's much harder for us to identify those people who are in need from a normal everyday perspective. If a 14-year-old goes to middle school, super depressed, thinking about suicide, there's 100 people that they will interact with in any given day that are going to notice that. If I go to work and I'm depressed, there's a dozen or so people around me most of the time who will see that and ask me, hey, how are you doing? How can I help you? How are you dealing with this? Is there anything I can do? And if they identify that there's an issue, they can seek that help. I think the suicide increase that we're experiencing and honestly going to continue to experience for some time in many areas is a result of not just the depression, but the fact that lay people that are out there and even a lot of professionals aren't able to interact with those people who may be thinking about suicide, who may be on that cusp of depression versus suicidal ideation. And once they're at the suicidal ideation, we're not there to intervene and say, how do I help you? So I think that that's something that needed to be addressed multiple times throughout this presentation, because really as professionals, our job is to make sure those individuals who need that help are getting it. And right now, we're in an interesting situation where we may feel like we're failing because we're not helping as many people as we normally would. But the reality is, in a lot of ways, we don't have that power. In other ways, we have different powers. So it's really a matter of, again, not just looking at how is this impacting the people we work with, not only how is this impacting the people we know, the people we love, but really how is it impacting us as far as self-care. So as I said, those are the foundations of the psychological aspects that are going on. With the foundations in place, we really look at what are we going to do with it. Well, knowing the foundations, we have an understanding of how to deal with the impact of the pandemic. Just as professionals, we diagnose individuals so that we know the best course, the best route to plan out that treatment. Knowing those foundations of really what everybody's experiencing right now is going to let us plan out our response in the short and the long term. What we're experiencing, stress, trauma, grief, isolation, they're all normal reactions. They're all normal things. But as therapists, what we know is normal doesn't mean it doesn't impact us. It doesn't mean that magically we're okay because it's normal. The fact that everybody's going to experience the death of their parents doesn't make the death of a parent somehow miraculously less impactful. One thing we have to consider is it's okay to feel those ways. It's normal to feel that way. But don't just sit with them. Don't be hard on yourself and just sit there and, let the person experience that. We need to move through those stages to recover. And so while it's normal, we have to address them in the present and in the future as we work with individuals who are long-term impacted by this. But while I say we all have to work through this, there's another piece that needs to be understood. Everyone is saying, come out of COVID, speaking a new language, having some new skill. I even referenced it as an outcome in a previous talk of how to really deal with the isolation and not working was, what's your goal? Do you want to learn a new language? Is there books you want to read? Is there some big project you've been putting off? I know people that have remodeled entire houses over the course of the last 2 months because it was something they had been putting off with work and school, but now that wasn't standing in the way. That said, I don't think we have to come out of it with some amazing new thing. In that same talk, I also referenced maybe it's Marvel, Avengers Endgame that you haven't watched. During the course of this, my wife has actually watched Age of Ultron. I don't know how she hasn't seen it before now, Other than I don't put off watching movies like that very long, and so she hasn't seen it. That's something positive that's coming out of it. She's catching up on the end of the Marvel universe. Sorry if there was any spoilers there, but yes, kind of the end of that 20-year saga. But the other thing is, Dr. Phil's popular because he is able to say, this is what's going on. Here's how you need to fix your life. As professionals, we all know that that's not really what therapy is. Yeah, if you're a life coach, I can say that life coaching sometimes, when we look at those aspects, is telling somebody exactly what they need to do. If somebody's suicidal, yeah, we tell them you need to go to the hospital. But impact long term for work such as that, such as Dr. Phil does, where he talks to somebody and within an hour fixes their problem. Really, it's a zero outcome. It may work in the short term, but it's not a long lasting. We've dealt with the issue and come out of it better. There's not a one size fits all. There's developing goals and steps to reach those goals, as there is with any therapeutic process. Some of those steps we're not completely in control of. Some of those steps are related to the restrictions and things that the governor or the president or your mayor or whoever is going to have to allow to be lifted. And then out of that, we work through some of those aspects long term. In the short term, we would work on it just as we would with a victim of domestic violence. Someone who's experiencing domestic violence may not leave. And so we work on harm reduction, looking at what can we do in the present to make the present better, even if it's not the best. And the other piece is, I think we have to admit to ourselves, make our patients aware, just as with any recovery is pain. Physical workouts involve pain, but that pain that we feel is a start of growth. From a physiological standpoint, that pain is actually micro tears in our muscles. What comes out of that is, as our body heals and recovers, it builds new muscle tissue. That's why our muscles grow bigger. Not that I have that, but as you work out and you tear your muscles, just as when you tear your skin, scab, a scar, it's new tissue being added and bulking up. Mental health workouts, mental workouts, psychological workout, whatever you want to look at it as being, it can be painful as well. But just like working out from the physical, you need that downtime to heal. You need to be able to take that step back and say, it's a tough day. I'll work through this piece. I'm going to give myself some time. The current normal, not the new normal. It's a time when it's okay to feel overwhelmed. It's a time that it's okay to not be hard on yourself about the fact that you haven't made these giant leaps in progress. And now you speak Russian and Mandarin as a result of being locked up for 2 months and having, use Rosetta Stone. If you don't come out of it with this new great skill, that's completely okay. For some people, it's hard to even get the motivation to clean a messy house. My wife is a stay-at-home mom. Like I said, I have a 4-year-old. She could literally pick up the house every single hour. And the next morning, it'd be beautiful. The second my daughter gets up, she's going to get the same toys back out. Now, yes, I'm all about picking up toys. Trust me, I get up at 5 a.m. It's so dark, I don't want to step on it. That said, it's hard to be motivated when it's the same repetitive stuff over and over and over and over. And it's hard to be motivated when you don't know what tomorrow's going to bring, and when all of the things that generally would make that difficult or hard work or the struggle of, doing whatever chore it is, somehow a little less painful because at the end we're going to go out to dinner. That's not there. Don't judge yourself. for, failure if you aren't an amazing teacher for your kids. Most of us did not sign up to be teachers, and honestly, some of the friends that I have who are actual teachers are not doing the best job of teaching their own children from home. The teachers, as they try and teach online, as a lot of that is limited, and so we also have to look at how is that impacting our child, and understand that they may not be doing the best in school, but that's also a failure, not on the teacher's part, not on the school's part, but just a failure that's a natural result of the fact that we have limitations in place with that learning process. I'll be completely honest that I would say don't judge yourself if you don't even put on pants this morning. If you're watching this and you haven't even gotten dressed for the day, it doesn't mean that somehow you're not moving forward. What it means is right now, that's not your key need. Your key need is to take care of you. Your key need is to address the current situation and what's going on, not make sure that you get drugged and you get dressed like every other day before you go to work. Clinical training teaches us it's okay not to accomplish everything and not to deal with every emotion at once, but it's not healthy to avoid all of it altogether all the time either. So while I say it's okay to not accomplish everything, it's not okay to sit there and to dwell on our grief. It's not okay, and it's not healthy for us or the individuals we work with, the individuals around us, to just sit there filled with anxiety, filled with fear, and not move forward in any way, not necessarily to achieving this great goal, but the simple goal of moving forward to recover from the impact of the pandemic and restrictions. So working through it. Anxiety is trying to predict, at least the way I look at it, anxiety is trying to predict what the future will bring and worrying about what you think the future might bring while also worrying you're wrong. I am worrying about whatever it is, and I'm trying to tell myself, here's what is going to happen tomorrow. Tomorrow I'm gonna have the coronavirus. Like I know I am. I have this tickle in my throat. I'm gonna have it. And you're worrying about what ifs. You're also worrying, what if I'm wrong? You can be anxious about money. What if I don't get a paycheck? What if unemployment doesn't come in? What if I can't pay my bills? That's going to create anxiety. My favorite way, honestly, when working with people and even personally, in some ways, is to combat anxiety or grounding techniques. And I think it's something that is so simple that even if it's a friend who's saying they're having a hard time, you can ask that question. As a professional, you can teach these obviously to your clients, but list what you see. In fact, like I'm sitting at a desk. It's well, it's not real wood, but it's like a reddish brown. It's smooth, that kind of thing. It's flat. How big is it? That type of thing. That is going to help you to look at the logical. You can also list off what you feel. It's hard, it's a little cool to the touch. It's very smooth. But again, this is going to take you out of that emotional. If you're feeling anxious, avoid the emotional and focus on the logical is another piece of grounding. What's your favorite TV shows? I'm a big Trekkie. Luckily, my camera's not facing over on the shelves. You would see some of my Star Trek items that I have at work in my office. But as nerdy as that is, to try and think through who all the characters on the Star Trek series, what were their ranks. You can do that with any number of things, and the idea is not to dwell on it so much, obviously, that you're going to create more anxiety because you can't think of, that Worf was an ensign and then actually, or a junior grade lieutenant, actually, and then became a full lieutenant and then a lieutenant colonel. Is that really important? No. We're not trying to worry ourselves. We're trying to remove the emotion and just think about fact. Just think about the five senses as far as sight, sound, touch, so that we're not in that emotional piece of our brain, but we're in the logical side. Overcoming depression and isolation, creative ways to overcome it. I would say avoid social media in some ways. A lot of times we look at social media like we're so connected. I have, I don't know, like 480 friends on Facebook. In real life, there's probably, outside of family members, 20 I've seen in the last 2 years. Am I really connected to them, or am I just watching their lives through a lens? Even less vivid than a TV show and a fake character. It doesn't make us more connected. It makes us think, honestly, in many cases, of all the things that we're not doing. Facebook memories will come up. This time, 2 years ago, I was in Europe working a contract for the Secretary of Defense. That was awesome. It was great. But I'm also daily reminded of what Germany was like and what England was like, what Switzerland like. And that's not something that is helping me with the fact that I'm not able to travel. Now that said, I would say embrace the virtual, embrace those social media platforms for the truest sense of what the word social means. And when I say that, right now, I'm doing this presentation, re-recording it. I did it as a presentation, actually for a local chamber. I was a little less clinical because it was for the general public, but I actually had a friend who was in far East Texas that watched it, and there's even a buddy of mine from my time in Germany who watched it live. That lets us connect with people that generally we don't get to connect with in some ways. And so there is that unique piece of embracing Skype and Zoom and all these technologies. We can have virtual get-togethers. Is it fun to each sit at our own house and smoke a cigar or drink a glass of wine with friends or whatever, do a virtual Zoom wedding? Is that as fun? No, it's really not. But in a lot of ways, it lets us reconnect. It is not going to a bar or going to a big dinner, but we're still connecting with people that we love and care and celebrating and sharing those times. And then the other thing that we honestly have just come to not do as a whole in this society, by and large, pick up the phone and actually talk to people. I've probably talked to my mom more during the whole coronavirus than the previous 2 years, simply because I literally in the beginning was calling her every day and talking to her for 30 to 45 minutes. So picked up that phone. Into restrictions and into issues now. The impact will far outlast the pandemic and the active restrictions. The trauma and grief is going to last past the event. It's a result of what we talked about earlier with that fear and anxiety, the unknowing of what will come next or if something will come next. The normal healing process of anxiety, trauma, grief, and general change is going to outlast this for everybody because it's a process. You don't come in after a divorce and you don't have a patient come into your office that just got divorced and they tell you they got divorced. It's over. Wow, I feel great. I walk out and I'm done. No, there's a process to that. And just like there is with any other psychological issue, trauma, event, we're going to have to look at this from a clinical perspective of what does treatment for the next 6 months, year, whatever time period that may be for that individual look like to address all the events that they've experienced during the pandemic and how it's impacted their psyche. When and where will the healing start? It is when the restrictions start to be eased. It can start before they're being eased. Right now they are being eased here in New Mexico. And little by little, we're able to embrace and heal a little more every day. And we can start to create the true new normal. or at least make a way towards that. Because as I said, we're really current normal until we're after this. Long-term psychological effect is an important thing too. The restrictions create a different far-reaching, for some, that is an important note. The economic impact of the restrictions, not a political statement at all. The shutting down of businesses in many ways has long-term impacted and destroyed a lot of individuals. Those people that have lost jobs, lost companies, they're going to face depression. They're going to face self-esteem and doubt issues about it, and that's not going to clear up easily, and it's not going to clear up quickly. Think about the psychological impact of an individual who spent a lifetime building a business or took over a parent's business, let's say a restaurant. And during this, their sales plummeted. They couldn't pay their bills and they've lost their restaurant. Some of those PPP programs and other business financial programs assisted with that. But I know here locally that there's several businesses that have gone out of business. I know that there's several private practices even just due to the lack of their technology as far as being able to do telehealth. It has closed their doors and they probably won't be able to reopen them. That's going to have an impact for them. And not just the impact of losing that, but the adjustment. Once I said that, I was in private practice and I'm a consultant. For me, my entire professional clinical career has pretty much been me in charge. In my role, I effectively, as Deputy Executive Director, served as Chief Operations Officer, which means above me is the Chief Executive Officer and above him the board. So I have a lot of people that I still answer to, and that was a shift. For many people, that's going to be a difficulty that's probably going to mean a string of jobs, complacency, unhappiness in the jobs. So that's an important thing that we need to look at for those people. As a result of some of those, you're also looking at just a loss of the business or a loss of self-esteem, but a loss of identity, divorce, and again, the increase in suicide that come as a result of feeling as though they failed, having lost and having no way to adjust. So I think as professionals, we're going to have to consider that with individuals that come in these situations. Not just look at how the restrictions impacted all of us, but look very closely at how a restriction and a loss of job or a loss of business impacted these individuals, and really consider, that there's already a marked increase in suicide and domestic violence. But as this goes on, even after the restrictions, even after the pandemic, for some of the individuals who experience long-lasting impact and effect, life-changing impact and effect, those are going to be items that I feel like are going to be persistent as well. Motivation for growth, I think, is something that we really need to think about too. And we're almost at the end of this training, so don't worry that this is going to go on beyond that hour. You're only getting to 1 hour CEU. So, but motivation and growth. We have to remember that this is an opportunity for growth. All change, forced, maybe especially forced, is a chance for growth. We're put into a hard situation, we're tested who we are, and we come out of it stronger. That's really what growth is. As professionals, there's going to be those that we work with years from now, as just said, that have those long lasting impacts. There's going to be people that talk about the trauma of COVID-19 and the year of 2020 and all the other things that have come up in, these 4 to 6 months that have been a little chaotic here, at least in the United States. But for most of us, it's going to be long term. For some of us, it'll be long term. For most of us, it's going to be short term. This is why we must make sure to address it in the now and stay aware of how it's impacting each of us, personally, professionally, in addition to just looking at how it impacts those people that we're working with, working for, and our coworkers. Again, we say that old normal, the current normal. The cool thing is we get to shape the future of normal. We're in a period where the government even doesn't know what's post-COVID look like. So we have a chance to create something great out of this. We have the ability and power to shape what our future days look like. And it's a unique situation that again hasn't been seen in 100 years. As far as a pandemic, hasn't been seen in quite some time for a lot of other events. Luckily, I will say. So, and I would say, we also need to look at the people that already have pre-existing conditions. Those with pre-existing mental health conditions, addictions issues, severe or mild, whether they're in recovery or they're actively symptomatic, this is most likely going to impact them more. This is true, like I said, if they're in remission from symptoms. I have a medical doctor friend, and she had stated that she had a lot of patients that have been coming in to get anti-anxiety or antidepressants that hadn't been on them for a long time. Why? Because this is a common feeling, as we talked about, grief, trauma, anxiety, all those are common feelings, but we don't generally attribute it to this. And so that skill set that we already had, we don't necessarily see it as transition to this. We may have anxiety about school or public speaking. I used to hate public speaking, honestly. And that fear was something that once I got over it, the way I went through the fear of public speaking, I'm able to transition that to most normal everyday fears to a point that I understand it because it's just really a fear of the unknown. And I don't have control of the unknown, that I don't have any active fears like flying or heights, those type of things. But for most people that have pre-existing conditions, that is going to be a concern we have to consider. And same with addictions issue. The more you isolate away, the higher, we've seen a soar in alcohol sales. But also, if you know the right people, law enforcement, or some of your patients may even talk about it, and there has been a massive increase in drug sales, illicit drug sales, that is. And so we have to consider that. It's okay for them not to be perfect. We have to really temper our work as therapists. With something that a buddy of mine, Hoss, he's got an MA in counseling, but he's also he was a sheriff's deputy for 25 years. And we used to hang out on Friday nights, and I heard him say, I don't even know how many times, it's okay to unpack and sit with your feelings. It's okay to, kind of slide back when there's a hardship. But at some point, we pack up our stuff, we stand up, and we take what we learned and we move forward and climb back up those stairs, and that's really what we need to think about with our patients and with our own lives. So one final thought, as I said, we get to shape that new normal, in the here and now. Some people are going to be overwhelmed as professionals. Those who care about others around us, we have to be aware of what others are experiencing. That's part of that shared trauma experience. Moreover, it's important to see the warning signs for those that are beyond their breaking point, and to make sure that the right help is received. But I'll end this with a final thought. It was a couple weeks ago. I was on a Saturday and I started thinking about everything that's going on and the restrictions, and made me think about my childhood. As a kid, I grew up within probably, 15, 20 miles of every family member, all my grandparents, all my cousins, aunts, and uncles were literally in this 15 to 20 mile radius of distance from where I lived. And so, Christmas would come around, and that was the tradition, was to do that, go see everybody. We had 2 big meals. We would do all the little things, and even as I got older, we would do stuff. I would do stuff at my house. I would go to my parents' house, and then I would go to my grandparents' house for those, Christmas or Thanksgiving or whatever. But a few years ago, I actually moved from Kansas. I moved to El Paso, Texas. Then I moved to Germany, moved back to Texas, and now I'm in New Mexico. So for the past 3 years, I've been over 1,000 miles from every family member that I have. But the kind of cool thing is, as a result of that, we started our own traditions. We got to create this new normal. of what holidays look like. And again, I said I don't really like that term, but it really is what our new normal is. You know, a lot of years we don't see our family members on holidays. I don't think we've seen family members on any holiday other than Christmas and Thanksgiving if we traveled there or they came and saw us since we moved, whether it's birthdays, Easter, whatever. But the kind of cool thing out of it is we get to decide what the new normal looks like. And so we can, not only for ourselves, but for those we work with, we get to help them decide what does coming out of this look like. You know, are we going to create something that we dread and we look back and we say, well, this was great? Or are we going to move forward and are we going to let go of those things that we held on to because they were how things were done? Those were the traditions, whether we liked them and enjoyed them or not. Or do we let those go? And do we really embrace and help them to embrace all those things that they would like their traditions to be? So that's the end of this presentation. If you paid for this presentation and are wanting the CE certificate, you will need to complete the evaluation form and return that to me. It can be scanned and emailed. You can open it as a Word document, or you know, you can contact me through the email and fax it back however you would like to get it back to me. Once I have that, then I will email you. Make sure you have a valid email as part of our communication. I will issue you your CEU certificate. Thank you for attending this training. I look forward to providing future trainings in person or via this new wonderful technology of online. If you have training needs, please feel free to reach out to us through the email that you requested this training through. Thank you.